Test.com's Radiology Technician Practice Test. For complete practice, try our full-length 500-question Radiology Technician Practice Exam Kit with fully explained answers, testing tips, and more. Patient care in radiology. Question 1. A patient comes in for a radiologic exam and requires an intravenous injection of contrast. What is the normal range for creatinine? A. 0 to 0.4 milligrams or 100 milliliters. B. 0.6 to 1.5 milligrams or 100 milliliters. C. 2.0 to 4.0 milligrams or 100 milliliters. D. 8 to 15 milligrams or 100 milliliters. B. 0.6 to 1.5 milligrams or 100 milliliters. This is the normal range for creatinine. Increasing your physical activities will help your creatinine levels. Low creatinine is dangerous and harmful. Muscle and liver disease can lead to lower creatinine levels. Elevated levels can lead to more harmful effects. Symptoms include nausea, vomiting, and high blood pressure. Higher creatinine symptoms include kidney failure and dehydrations. Question 2. In which position should the patient be placed if they have a syncopal episode and low blood pressure? A. Right lateral recumbent. B. Trendelenburg. C. Semifowler's. D. Sims. D. Sims. The Sims position is also called the recovery position. The patient is placed recumbent on their left side. This reduces the likelihood of aspiration and helps maintain the patient's airway. The right main stem bronchus is longer and straighter than the left, so if the patient were to vomit during the episode, the right lateral recumbent position would actually increase the patient's likelihood of aspiration. Trendelenburg position is one wherein the head is lower than the feet, which is not appropriate for patient management during this scenario, as it increases the likelihood of aspiration or airway obstruction. The Semifowler's position places the head higher than the feet, which makes it more difficult for blood flow to reach the brain in this scenario. Question 3. Consider a patient with a long bone fracture. Which of the following is the most appropriate method of manipulating the affected extremity for imaging purposes? For example, to place the image receptor under the affected extremity. A. Manipulate the end distal to the fracture site. B. Manipulate both ends of the extremity simultaneously and in unison. C. Manipulate the end proximal to the fracture site. D. Manipulate the fracture site directly. B. Manipulate both ends of the extremity simultaneously and in unison. In this instance, the radiographer should manipulate both ends of the extremity simultaneously and in unison. This will reduce patient pain and also ensure that the fracture fragments remain in proper anatomical alignment. Manipulating only one end of the extremity in this instance would increase patient pain and may lead to increased instability of the fracture. Manipulating the fracture site would cause the patient great pain and compromise alignment of the fracture fragments. Question 4. Which of the following is an essential lab value that must be verified prior to administering intravenous iodinated contrast media, as it provides information on a patient's kidney function? A. White blood cell count. B. Creatinine. C. Hemoglobin. D. Aspartate aminotransferase. B. Creatinine. Creatinine is a breakdown product of muscle metabolism. It is an important factor in monitoring kidney function, and higher than normal creatinine levels could indicate reduced kidney function. A patient with high serum creatinine could experience renal failure as a result of administering iodinated contrast media. The WBC is a measure of the number of white blood cells in the patient's blood. While crucial in fighting infection, this value is not indicative of appropriate kidney function. Hemoglobin is a measure of the iron-containing protein in the blood that is responsible for oxygen transport. While crucial for proper physiologic function in the body, It is not related to kidney function and therefore is not a crucial value for IV contrast administration. AFT is one of many measures of liver function, not kidney function. Question 5. Which of the following is a type of manual respirator? A. AMBU, B. Extracorporeal membrane oxygenation, or ECMO, C. Mechanical ventilator, D. Continuous positive airway pressure, or CPAP. A. AMBU. An AMBU bag is a manual respirator that is operated by squeezing a bag by hand every few seconds to help maintain airflow. They are usually used to maintain oxygenation prior to a patient being placed on a mechanical ventilator. ECMO devices utilize an artificial lung to provide adequate oxygenation to patients whose heart and lungs cannot adequately perform gas exchange. Mechanical ventilators assist patients with respiration post-intubation to allow the lungs to heal following an injury or severe illness. CPAP devices provide continuous airway pressure in patients with sleep apnea to help prevent airway collapse. Question 6. R.T. Jones leaves a patient on the exam table unattended. This is most likely an example of A. Beneficence, B. Battery, C. Libel, D. Negligence. D. Negligence. A person who is negligent does not behave in the manner that a reasonable person would in a similar situation. Leaving a patient unattended on the exam table is one possible example of behavior that could be described as negligent. Beneficence describes acting in a manner that will benefit others and is something that all healthcare professionals should strive for. Battery describes the unlawful application of force. An example in radiology would be applying hard patient restraints for immobilization without consent or a physician order. Libel describes publishing written statements that can defame one's reputation. One example would be documenting defaming information in a patient's electronic medical record, or EMR. Question 7. A patient is having a CAT scan of the head. After injecting contrast, the patient complains of nausea and having problems breathing. What type of shock is the patient experiencing? A. Septic, B. Anaphylactic, C. Cardiogenic, D. Neurogenic. B. Anaphylactic. Anaphylaxis shock is a severe, potentially life-threatening allergic reaction. A patient can experience nausea, vomiting, low blood pressure, and trouble breathing. Anaphylaxis is treated with an injection of epinephrine. Septic shock is because of infections. Heart problems will lead to cardiogenic shock. Neurogenic shock is caused by damage to your nervous system. Question 8. What is the function of the housing around an X-ray tube? A. Keeps heat inside the glass envelope. B. Promotes electrical shock. C. Minimizes radiation leakage. D. Helps with image production. C. Minimizes radiation leakage. One of the primary functions of the housing is to minimize radiation leakage. The X-ray tube is lined with lead and helps minimize leakage. Glass tube envelopes are made of borosilicate glass. This helps with the heat inside the tube. The housing does not retain the heat from the glass tube. The housing around the X-ray tube is there for electrical shock protection. The housing around the X-ray tube has nothing to do with image production. Question 9. The reddening of irritated skin due to radiation is called what? A. Psoriasis, B. Petechiae, C. Erythema, D. Eczema. C. Erythema. Erythema is the redness of the skin caused by the congestion or increased blood flow of capillaries in the lower layers of skin. Erythema is a common side effect of radiotherapy treatment. Psoriasis starts underneath the skin. It is a chronic disease of the immune system. Petechia are pinpoint round spots that appear on the skin as a result of bleeding. Eczema is a common skin condition marked by itchy and inflamed patches of skin. Question 10. What is the position when a patient lies flat on their back and the head is lower than the feet? A. Fowler's, B. Trendelenburg, C. Sims, D. Lateral recumbent. B. Trendelenburg. Trendelenburg is when a patient lays in a supine position with the head lower than the feet. The degree of inclination is 15 to 30 degrees. Fowler's is when a patient is sitting up in the bed. When a patient lies on the side, with the knee and thigh drawn upward toward the chest, it's the Sims position. Lateral recumbent refers to a patient that is lying on their side. Question 11. When a patient is having a barium enema, what are the instructions after the examination? A. Don't drink fluids for 6 hours. B. Withhold taking a laxative. C. Drink plenty of fluid. D. Don't monitor your bowel movements. C. Drink plenty of fluid. A barium enema is an X-ray exam of the large intestine to detect any changes or abnormalities. After the exam, it is recommended to drink fluids for the next 6 hours. This will help move the barium through the bowels. Patients should use laxatives to help relieve the pressure in the bowels. It is very important to monitor bowel movements. Bowel movements may be light in color for up to 72 hours after a procedure and should be checked for bleeding. Question 12. The best time to use the log rolling method to move a patient is when the patient may have A. Ankle fracture, B. Head trauma, C. Wrist pain, D. Spinal injury. D. Spinal injury. When moving a patient with a suspected spinal injury, it is recommended to use the log rolling technique. This will minimize any damage to the spine. A log roll is not necessary when patient has an ankle fracture. If the patient has head trauma, then stabilizing the neck is a top priority before a log roll is used. Radiation and safety. Question 13. When parts of the body are being imaged, what restricts the useful X-ray beams from causing unnecessary exposure? A. Protective barriers, B. Collimation, C. Filtration, D. Cassette size. B. Collimation. Collimation restricts the useful X-ray beam to the part of the body being imaged and thereby spares adjacent tissue from unnecessary exposure. Protective barrier refers to lead shielding and glass barriers. These are not used when restricting the X-ray beam. Filtration is when metal filters are used to absorb low-energy X-rays emitted from the X-ray tube. It does not restrict the X-ray beam in any way. Cassette size is determined by the anatomy being imaged. It cannot restrict the X-ray beam. Question 14. Which target interaction is caused by a deceleration of a cathode electron? A. Characteristic, B. Bremsstrahlung, C. Compton, D. Coherent. B. Bremsstrahlung. Bremsstrahlung radiation is also called braking radiation and results from an incident cathode electron decelerating and changing direction as it passes by the nucleus of a target atom. Characteristic radiation is a target interaction caused by the removal of an inner shell electron from the target. Compton scattering is an interaction with matter, not the target, and produces scattered radiation. Coherent scattering is an interaction with matter that does not cause ionization. It is a photon interaction with matter, not a target interaction. Question 15. Which biological effects of radiation are random in occurrence? A. Stochastic, B. Teratogenesis, C. Acute radiation syndrome, D. Deterministic. A. Stochastic. Stochastic effects are randomly occurring radiation effects with no threshold dose. Carcinogenesis and genetic effects are the primary stochastic biological effects of radiation. Teratogenesis describes birth mutations caused by direct irradiation of the fetus. Acute radiation syndrome, or ARS, occurs after a large dose of radiation is received, below which the condition does not manifest. ARS can be subdivided into hematopoietic, gastrointestinal, and central nervous system responses. They are not randomly occurring responses to radiation. Deterministic effects of radiation exhibit a threshold dose, i.e., below a certain quantity of radiation, no effect will occur. They are not random in nature. Radiation-induced cataracts are one example of a deterministic effect of radiation. Question 16. Which of the following is the unit for radiation dose equivalent? A. Gray, B. Coulomb per milligram, C. Rad, D. Sievert. D. Sievert. Sievert, or SV, is used to measure dose equivalent, which takes into account absorbed dose as well as the type of radiation that caused the exposure. Gray, or GY, is used to measure absorbed dose in matter as well as air karma. Coulomb per kilogram is used to measure exposure, usually in the air. The rad is the traditional unit of absorbed dose. Question 17. Which of the following will help reduce radiation exposure to the patient? A. Decreasing kVp, B. Utilizing AEC, C. Increasing MAS, D. Utilizing radiographic grids. B. Utilizing AEC. Proper use of AEC will ensure that the appropriate MAS is being used for the body part, helping to control patient dose. Decreasing kVp will increase photoelectric absorption of radiation, which contributes to patient dose. Increasing MAS will produce more photons in the primary beam, which will exponentially increase patient dose. While beneficial for image quality, radiographic grids require the use of more MAS to compensate for the grid, thereby increasing patient dose. Question 18. Leakage radiation may not exceed blank at a distance of 1 meter from the X-ray source. A. 100 milliroentgens per hour, B. 10 roentgens per minute, C. 150 milliroentgens per minute, D. 200 milliroentgens per hour. A. 100 milliroentgens per hour. Leakage radiation may not exceed 100 milliroentgens per hour at a distance of 1 meter from the X-ray source. Leakage radiation is radiation that exits the X-ray tube housing from any route other than the port and/or window. 10 roentgens per minute is above the upper limit of allowable leakage radiation. 150 milliroentgens per minute is above the upper limit of allowable leakage radiation. 200 milliroentgens per hour is above the upper limit of allowable leakage radiation. Question 19. A unit of measuring radiation is REM. What does REM stand for? A. Radiation equivalent man, B. Roentgen early man, C. Radioactive early management, D. Radiation evolved management. Radiation equivalent man. REM, or radiation equivalent man, is used to express the quantity of radiation received by humans. Roentgen is responsible for discovering X-rays. He is not responsible for the unit of measurement. Radioactive early management is not a term used to measure a unit of radiation. There are no acronyms that stand for radiation evolved management. This does not measure radiation. Question 20. According to the NCRP, or National Council on Radiation Protection and Measurements, what is the minimum lead requirement for lead aprons? A. 0.50 millimeters lead, B. 0.25 millimeters lead, C. 0.35 millimeters lead, D. 0.75 millimeters lead. A. 0.50 millimeters lead. The NCRP requires that lead aprons have a minimum of 0.50 millimeters lead. Lead gloves have to be 0.25 millimeters lead. The thyroid shield and Bucky slot cover have the same requirements. A 0.35 requirement is for lead glasses. These tend to be used in long fluoroscopy cases. There is nothing that requires a minimum of 0.75 millimeters lead. Question 21. Of the total radiation exposure of the general public, what percentage comes from medical and dental radiation? A. 90%, B. 2%, C. 37%, D. 5%. A. 90%. Medical and dental radiation make up 90% of the radiation given to the general public. Consumer products and industrial exposure, which includes the exposure from nuclear power plants, makes up 2% of radiation. Radon is 37% of rad levels, depending on the uranium content of the soil. About 5% of the radiation is from outer space and is called cosmic radiation. Question 22. What is a principle of radioprotection stating that whenever ionizing radiation has to be applied to humans, it should be as far below the dose limits as practical? A. Coulombs per kilogram, B. DAP, C. FID, D. ARRT. D. ARRT. ARRT stands for as low as reasonably achievable. This should be remembered whenever using ionizing radiation on humans. C/kg stands for Coulomb per kilogram. DAP stands for dose area product, a quantity used to assess a radiation risk from diagnostic X-rays. FID is short for focus to isocenter distance. Question 23. What is one of the duties of a radiation safety officer? A. Conduct a yearly review of records on radiation levels. B. Conduct quarterly review of the radiation safety program. C. Conduct annual briefings and educational sessions with employees. D. All of the above. C. Conduct annual briefings and educational sessions with employees. A radiation safety officer, or RSO, will schedule briefings and educational sessions to inform workers of ARRT programs, and this should be done annually. An RSO reviews radiation levels quarterly. A radiation safety program is reviewed annually. It is an RSO's responsibility to review radiation levels in unrestricted and restricted areas to determine that they were at ARRT levels. Question 24. What is a chemical substance that kills pathogenic bacteria? A. Disinfectant, B. Antiseptics, C. Chloroform, D. Wet wipes. A. Disinfectant. Disinfectants are used to kill pathogenic bacteria. These can come in liquid sprays, wipes, and aerosol. When preventing or arresting the growth of microorganisms, it is best to use an antiseptic. Chloroform is not used to kill any kind of bacteria. It is a liquid used as a solvent and formerly as a general anesthetic. Wet wipes are used to remove dirt and other particles from the skin. Image production. Question 25. Which of the following is considered a geometric factor that causes unequal magnification of different portions of the same object? A. Quantum model, B. Noise, C. Focal spot blur, D. Distortion. D. Distortion. When a radiographic image has unequal magnification of different portions of the same object, this is called distortion. This is also considered a geometric factor. Quantum model does not change the size of the image. It refers to the random nature in which X-rays interact with the image receptors. Noise is considered a geometric factor and is the undesired fluctuation in the optical density. It does not affect the magnification. Even though focal spot blur is considered a geometric factor, it refers to a blurred region on a radiologic image. It does not affect the magnification. Test.com's Radiology Technician Practice Test. For complete practice, try our full-length 500-question Radiology Technician Practice Exam Kit with fully explained answers, testing tips, and more. Question 26. Which of the following changes are necessary when imaging a patient in a dry fiberglass cast? A. Increase KVP, B. Increase MAS, C. Increase grid ratio, D. No change in technical factors are necessary. D. No change in technical factors are necessary. Dry fiberglass casts are radiolucent, meaning they do not absorb or attenuate the X-ray beam. Therefore, no change in technical factors are required in this scenario. KVP should be set in accordance with the body part being radiographed to provide the appropriate scale of contrast. The presence of a dry fiberglass cast should not impact the selection of appropriate KVP for the exam. Increasing MAS is not necessary for patients with a dry fiberglass cast. Since the fiberglass material does not attenuate and/or absorb photons, no increase in MAS is necessary. Radiographic grids improve contrast by removing scatter radiation before it interacts with the IR. Dry fiberglass casts do not produce scattered radiation, so the use of radiographic grids should be dictated by the size of the part being imaged, not the presence of a cast. Question 27. Which of the following would contribute to the appearance of quantum model or image noise on a digital radiograph? A. Higher energy beam. B. An MAS setting that is too low. C. Using the small focal spot size. D. Utilizing lower ratio grids. B. An MAS setting that is too low. An MAS setting that is too low will result in the body part and IR not receiving the appropriate quantity of X-ray photons, resulting in the appearance of quantum model or image noise. Image noise presents as a grainy appearance on the underexposed areas of the radiograph. Using a higher energy beam would increase X-ray transmission through the object. This would result in a higher image signal and less image noise. This is desirable. Focal spot size is an influencing factor of spatial resolution. It is not related to quantum model. Lower ratio grids allow more photon transmission to the IR, which reduces quantum model compared to using higher ratio grids. The appropriate grid ratio should be selected in accordance with the body part being radiographed, with MAS adjusted as appropriate to compensate. Question 28. Which post-processing technique sharpens the outlines of anatomical structures on the radiograph? A. Smoothing. B. Edge enhancement. C. Histogram manipulation. D. Digital subtraction. B. Edge enhancement. Edge enhancement sharpens the outlines of structures on the radiograph. This can be useful to evaluate interstitial lung markings or fracture margins more clearly. However, the use of edge enhancement in post-process could increase image noise. Smoothing is performed in post-processing to reduce the appearance of image noise. An undesirable consequence of applying smoothing in post-process is a less defined, softer appearance to the image. The histogram can be adjusted to alter the brightness and contrast resolution of the image. It is not related to image sharpness. Commonly used in fluoroscopy and interventional procedures, digital subtraction can effectively mask high attenuation structures such as bone so they do not superimpose anatomy, such as vascular structures. This technique is not related to image sharpness. Question 29. Which MA range is used for fluoroscopic procedures? A. 0.5 to 5 MA. B. 5 to 10 MA. C. 50 to 100 MA. D. 100 to 150 MA. A. 0.5 to 5 MA. Very low MA values between 0.5 and 5 MA are used for fluoroscopy due to the greatly increased exposure time compared to conventional radiography. The use of low MA values helps reduce patient radiation exposure as much as possible, since the X-ray tube is continuously energized during fluoroscopy procedures. Options B, C, and D are too high for fluoroscopy. Combined with the increased exposure time caused by the X-ray tube being continuously energized, this MA value range would result in excessive patient dose. Question 30. How frequently should computed radiography, or a CR image receptors, be erased? A. Daily. B. Weekly. C. Monthly. D. Quarterly. A. Daily. CR image receptors are highly susceptible to background fog, which can affect image quality by creating excess exposure. Due to this, all CR image receptors in the department must be erased at least once per day. Question 31. What is the best way to only change the density on an X-ray image? A. KVP, B. Filtration, C. SID, or source image receptor distance, D. MAS. D. MAS. When you change the MAS, this controls radiographic density. It does this by the quantity of X-rays produced. KVP deals more with changing the contrast of an image. The amount of penetration does not change the density. Filtration does not change the density in any way. SID changes the intensity and the density of a radiographic image. Therefore, it cannot change the density only. Question 32. In what year did Thomas Edison invent fluoroscopy? A. 1895, B. 1896, C. 1913, D. 1920. B. 1896. In 1896, Thomas Edison invented fluoroscopy. His discovery of calcium tungstate screens were effective for turning X-rays to visible light. Wilhelm Röntgen produced the first X-ray on November 8th of 1895. This later earned him a Nobel Prize in 1901. The X-ray went public in 1920. Law enforcement started using it to inspect packages and luggage. Coolidge tubes were invented in 1913. These tubes enabled continuous X-ray emissions. Question 33. What is the best way to alter the quality of an X-ray beam? A. KVP, B. MAS, C. Gray, D. REM. A. KVP. Kilovoltage peak, also known as KVP, is the peak voltage applied to X-ray. It alters the quality of the beam. Milliampere seconds are also more commonly known as MAS. This is a measurement of radiation produced over a set amount of time. A unit of absorbed dose is known as a Gray unit. REM, radiation equivalent man, is a unit of the radiation dose from an X-ray. Question 34. Which of the following is not part of a quality assurance program? A. Making sure the efficiency of equipment, B. Making sure the patient is satisfied, C. Consistent quality of the radiographic images, D. Keeping a low patient dose. B. Making sure the patient is satisfied. Making sure the patient is satisfied is very important, but it is not necessary for a quality assurance program. Efficiency of the equipment is a very important part of a quality assurance program. Having consistent quality in every radiographic image can be vital to a radiology department. Low patient dose is definitely needed in a good quality assurance program. Question 35. What is the proper way to view a radiograph? A. View the radiograph as if the patient was facing away from you. B. Any view is fine as long as you can see the X-ray. C. View the radiograph as if the patient was facing toward you. D. View the radiograph as if the patient was laying on their side. C. View the radiograph as if the patient was facing toward you. The correct way to view a radiograph is for the patient to be facing you. Most radiographs will have a right or left marker. It is incorrect to view the X-ray with patient away from you. It is universally accepted that when viewing a radiograph, the patient is facing you. There are markers on a radiograph to help make sure you have it facing the correct way. It is incorrect to position the film as if the patient was on their side. Question 36. A system used to view radiographs is called PACS. What does PACS stand for? A. Projection Access Communication Systems, B. Printer Analog Computer Systems, C. Picture Active Computer Systems, D. Picture Archiving and Communication Systems. D. Picture Archiving and Communication Systems. PACS stand for Picture, Archiving, and Communication Systems. This technology provides storage and convenient access to images from multiple modalities of radiology. Procedures in radiology. Question 37. A patient comes in complaining of abdominal pain and the doctor orders an X-ray of the abdomen. Afterwards, you compare it to the last image the patient had taken and you see this X-ray. What is the name of this X-ray position? A. Cub, kidneys, ureter, and bladder. B. Lateral decubitus. C. Upright abdominal X-ray. D. IVP, or intravenous pyelogram. B. Lateral decubitus. In a lateral decubitus, it is essential that the elevated lateral abdominal wall is included on the image to detect any free intraperitoneal gas. The patient will usually drink barium to help coat the intestinal wall. A cub is a generic X-ray used to evaluate the abdomen with no obstructions. The barium that is visualized makes it hard to see all the anatomy of the abdomen. When trying to evaluate air underneath the diaphragm, an upright abdominal X-ray can be utilized. An IVP is used when evaluating the patient's urinary tract. The patient is injected with contrast, and images are taken in 5-minute intervals to show the flow of urine. Question 38. A female patient comes in with fertility problems. The doctor orders a hysterosalpingogram. When is the best time to perform this procedure? A. Right before her period. B. 2 days after her period has started. C. 3 days after her period has ended. D. Anytime during a period. C. 3 days after her period has ended. The fallopian tubes are most suitable for an examination 3 days after a period has ended. Right before is not a good time because the body is preparing for the menstrual cycle. The contrast used to elevate the fallopian tubes will be filled with blood and will not give accurate results. During a period is not recommended because the blood is flowing out. It is hard to get helpful results if the fallopian tubes cannot be filled correctly. Question 39. On a posterior anterior chest radiograph, which of the following should be included on the X-ray? A. Maximum of 8 posterior ribs. B. Exhaled lungs. C. The trachea, including upper thoracic. D. Top of iliac crest. C. The trachea, including upper thoracic. On a correct chest X-ray, the trachea, lungs, and upper thoracic should be visualized. If the patient is positioned correctly, more than 8 posterior ribs should be visualized. There should be 10 posterior ribs easily visualized. A chest X-ray should be taken on inspiration. The lungs are not properly displayed if they are not fully expanded. If the top of the iliac crest is seen, then the film is positioned too low. If the crest is visualized, then more likely the top of the lungs will be cut off. Question 40. A patient comes into the ER and has a skull X-ray taken. Which bone is fractured in this skull X-ray? A. Styloid process. B. Parietal bone. C. Nasal bone. D. Zygomatic bone. D. Zygomatic bone. The zygomatic arch is fractured on the left side. The zygomatic bone is located below and lateral to the eye socket. The styloid process is unable to be visualized on this view. This bone is a slender, pointed part of the temporal bone. The parietal bone is located on the sides and roof of the cranium. The arrow is pointing to a bone that is lateral of the nasal bone. The nasal bone is the central line in the middle of the skull. Question 41. What is it when the stomach protrudes through cardiac orifice through tear of the diaphragm? A. Small bowel obstruction. B. Hiatal hernia. C. Pleural effusion. D. Appendicitis. B. Hiatal hernia. An abdominal hernia is an opening in the abdominal wall through which abdominal contents can protrude. A blockage keeping liquids or foods from passing through the small intestine is called a small bowel obstruction. Fluid on the lungs is clinically called pleural effusion and does not tear the diaphragm. Appendicitis is inflammation of the appendix, which is located at the junction of the small and large intestines, not near the diaphragm. Question 42. How is this shoulder positioned? A. Lateral. B. Internal rotated. C. External rotated. D. None of the above. C. External rotated. The shoulder is rotated externally. The greater tuberosity is turned medially. The lateral view is the side of the shoulder. This view is to help visualize the scapula. The greater tuberosity is lateral on the head of the humerus. This view is internally rotated. Question 43. A female patient comes in for an X-ray procedure with the diagnosis of GERD. What does GERD stand for? A. Gallbladder esophageal reflux dysfunction. B. Gastroesophageal reflux disease. C. Gastroesophageal reflex disease. D. Gastroesophageal reflex dysfunction. B. Gastroesophageal reflux disease. GERD is a condition in which the stomach contents pass back up into the esophagus. It stands for gastroesophageal reflux disease. Question 44. Which bone is broken in this oblique of the hand? A. Carpal bone. B. Middle phalanx. C. Metacarpal bone. D. Proximal phalanx. D. Proximal phalanx. The fracture is the fifth proximal phalanx. The proximal phalanx connects the metacarpal bone to the middle phalanx. The carpal bones make the wrist. There are a total of 8 bones in the wrist. The middle phalanx connects to a proximal and distal phalanx. The metacarpal bones make up the palm of your hand. The fracture is outside the palm. Question 45. What condition does this patient have? A. Broken rib. B. Situs inversus. C. Pleural effusion. D. Dislocated shoulder. B. Situs inversus. This patient is suffering from a condition known as situs inversus. The major visceral organs are reversed or mirrored from their normal positions. The ribs are easily visualized and none of them are broken. Pleural effusion is fluid around the lungs. The corners for the lungs are typically rounded when fluid is present. This image does not show a dislocated shoulder. Question 46. Which reference line is placed perpendicular to the image receptor for the PA axial projection of the skull, Caldwell method? A. Interpupillary line, or IPL. B. Glabellomeatal line, GML. C. Orbitomeatal line, OML. D. Infraorbitomeatal line, IOML. C. Orbitomeatal line, OML. The OML runs between the middle of the orbit and the EAM. It is placed perpendicular to the IR for the PA axial projection, or Caldwell method, of the skull. The IPL runs through both pupils, hence the name. It is placed perpendicular to the IR for the lateral projection of the skull. The GML runs between the glabella and external auditory meatus, EAM. It is a positioning reference for the AP axial projection, the Town method, of the skull. The IOML runs from the inferior margin of the orbit to the EAM. It is placed parallel to the IR for the submentavertical projection of the skull. Question 47. Which of the following positions and/or projections will best demonstrate the esophagus during a barium swallow fluoroscopic exam? A. LAO. B. RAO. C. PA. D. RPO. B. RAO. The RAO position demonstrates the esophagus free of superimposition of the thoracic spine and heart shadow. It provides the best visualization of the esophagus during fluoroscopy. The LAO position is not ideal for demonstrating the esophagus, as it results in superimposition over the heart shadow. The PA projection is insufficient for demonstrating the esophagus, as it is superimposed on the thoracic spine. The RPO position is equivalent to the LAO position and is not ideal for demonstrating the esophagus, as it results in superimposition over the heart shadow. Question 48. What is the most commonly fractured carpal bone? A. Capitate. B. Hamate. C. Scaphoid. D. Pisiform. C. Scaphoid. The scaphoid is located in the proximal row of carpals adjacent to the radius and is the most commonly fractured carpal bone. Pain and tenderness in the anatomical snuff box area of the wrist is a very common clinical sign of scaphoid fracture. The capitate is the largest carpal bone. Due to its location in the middle of the wrist, it is not the most commonly fractured carpal bone. The hamate has a prominent hook-like projection on its anterior surface that can be involved with carpal tunnel disorders. It is not a commonly fractured bone. Due to its small size and location on the medial aspect of the wrist, the pisiform does not often fracture. It is, however, an important site for muscular attachment in the wrist. Question 49. How should the patient's lower extremity be positioned for the AP projection of the hip? A. Neutral position. B. Externally rotated 5 to 10 degrees. C. Flexed 20 to 25 degrees at the hip. D. Internally rotated 15 to 20 degrees. D. Internally rotated 15 to 20 degrees. Internal rotation of the lower extremity demonstrates the greater trochanter and femoral neck in profile. It is important to rotate the patient's entire lower extremity internally if possible, not just the foot and ankle, to ensure appropriate visualization of these structures. The neutral position will result in foreshortening of the femoral neck and superimposition of the greater trochanter on the femoral neck. The patient's lower extremity should only be left in the neutral position if internal rotation is painful or if the patient has a suspected fracture. External rotation will result in foreshortening of the femoral neck and superimposition of the greater trochanter on the femoral neck. It is important to demonstrate the femoral neck in profile on the AP projection of the hip. Hip flexion will result in foreshortening of the femoral neck and proximal femur. The hip is flexed as well as abducted for the Cleaves frog leg method, not the AP projection. Question 50. Evaluate the left lateral chest radiograph below. Which of the following procedural errors is evident? A. The patient's right side is rotated. B. The patient's left side is rotated. C. The CR is not aligned properly to the anatomy. D. The patient did not take a deep enough inspiration. A. The patient's right side is rotated. The right lung appears magnified on the left lateral projection of the chest. The right lung appears posterior to the thoracic spine, indicating rotation of the right side in this example. The left lung and heart shadow appears without magnification on the left lateral projection of the chest because it is closest to the IR. The heart shadow and left lung appear normal on the image above. The right side is rotated. The CR in the image above is roughly directed to the middle of the lung fields at the level of T7. This is appropriate centering for the left lateral projection on the chest and is not an issue on the given image. The patient did take a sufficient inspiration on the image above. This is evidenced by the 10 pairs of ribs that can be counted within the lung fields. Thanks for watching Test.com's Radiology Technician Practice Test. For complete practice, try our full-length 500-question Radiology Technician Practice Exam Kit with fully explained answers, testing tips, and more.